Good morning to one and all. Uh, my topic is on xeroderma pigmentosum, its clinical presentation and histopathological correlation. Xeroderma pigmentosum, as we all know, is a rare genetic disorder and characterized by solar injury to the exposed skin and ocular tissues, autosomal recessive in inheritance pattern. The defect is due to the enzymatic repair in UV-induced damage in DNA. The ocular manifestations include eyelids, conjunctiva, sclera, and cornea in xeroderma. Corneal involvement is mainly in the form of dryness, haze, edema, exposure keratitis, pterygium-like growths, and epithelium neoplasms. Corneal opacification may result in XP from epithelial stromal changes or secondary to endothelial decompensation as a result of ongoing damage. The need for visual rehabilitation is XP mostly is due to corneal involvement, and intervention can be required in the form of penetrating keratoplasty or lamellar keratoplasty. Eventually, keratoprosthesis can also be of great help in single-eyed patients. There are few reports describing the histological corneal changes also in xeroderma pigmentation already reported before, and it can range from epithelium to endothelium involving all the layers of cornea. The purpose of our study was to review clinical and histopathological examination findings in xeroderma pigmentosa patients undergoing corneal transplantations. It was a retrospective and interventional analysis, and we assessed clinical findings and outcome of keratoplasty along with histopathological findings from the button excised. There were total 14 eyes of 11 patients, out of which 11 patients underwent penetrating keratoplasty and 3 underwent lamellar keratoplasty. Patients included from 1999 to 2019. The mean age at surgery was 21.4 with male preponderance. Male to female ratio was 5:1. 11 patients underwent penetrating keratoplasty and 3 lamellar, out of which 9 patients underwent it for maculoleucomatous corneal scarring, followed by epithelial neoplasm in 4 patients, and 1 patient presented with descemetocele. Lamellar keratoplasty in 3 patients was mainly indicated for surface tumors, OSSN, and penetrating keratoplasty was done for maculoleucomatous vascularized opacity. We noticed 5 graft failures, out of which 4 was in penetrating group at mean duration of 14 months. And clear grafts was noticed in almost 60% of the patients with mean follow-up of 5 years. This was one 14 years old female patient who had both eyes maculoleucomatous opacities, and she is doing well now at 5 years of follow-up with BCU maintaining more than 6/5/15 in her right eye. This was another patient who underwent lamellar keratoplasty for squamous cell carcinoma. It was microinvasive, and post-excision the graft failed. Histopathological changes included all the layers, in which epithelium was involved in 80% of the patients in the form of thin and atrophic keratinized epithelium. Bowman's layer was noted to have absent to focally deficient. Almost 100% patients had endothelium loss. This is a histopathological slide in dysplastic cell carcinoma. So in all other literature reported before, we had the similar findings with 100% endothelium involvement. The Kanavi et al., they also noted cholesterol clefts in along with above mentioned features. So to conclude, better outcome of keratoplasty in XP is possible despite ocular surface and adnexal complexities. Endothelial cell loss forms the hallmark of histopathological change and hence important in planning type of surgery also. Close monitoring as usual is crucial. Thank you.
Any specific post-operative regimen do you follow with medications?
No, sir, we follow the topical and lot of lubricants we follow, sir, because these patients will be having some or the other amount of limbal stem cell deficiencies. Because of lid-related issues, the patients would be having exposure keratitis, some ectropion and all. So lubricants, they help a lot. Also, in some patients, we might need to do tarsorrhaphy for better surface healing, sir.
Yeah. So tarsorrhaphy was done in any of your
Yes, ma'am. It was done in almost 3 to 4 patients. Actually, the study is till 2019. After that, also one patient underwent keratoprosthesis with lateral tarsorrhaphy.
And what was the reason for graft failure in your series?
Ma'am, in 3 patients, it was patient had gross ectropion and also there was eventual surface-related issues with total LACD. And other patient, ma'am, surfaced this lamellar keratoplasty. One patient underwent for squamous cell carcinoma. There was recurrence of carcinoma also, ma'am.
What were your visual results?
Ma'am, it was
the
in
percentage of grafts that stayed clear and
60% of the patient had clear grafts, ma'am, at 5 years of follow-up.
So what was the vision?
More than 6/60 of vision they were maintaining, ma'am.
Thank you.
Okay, thank you.